Hi, Steve Harden, Chairman and CEO of LifeWings Partners, with some important information about nursing turnover and safety and quality. Recent research has revealed that fully 25% of our nation's nurses are going to seek new jobs in the coming year, mainly because of job dissatisfaction. This will definitely impact safety and quality in our nation's hospitals. Research has shown there's a direct correlation between nursing turnover and risk-adjusted mortality and length of stay. So hospitals and units within hospitals that have lower nursing turnover have a lower risk-adjusted mortality and also shorter lengths of stay. If you have higher turnover, your risk-adjusted mortality is higher and your length of stay is longer. Other research has revealed that there's a direct relationship between nursing turnover and communication errors, which we know is the primary cause of adverse events that end up harming our patients. Also, nursing turnover is directly related to medication errors, patient disengagement, and also prolongs patient illnesses. So we definitely need to keep the nurses that we have. And if impacting safety and quality of care wasn't enough, it's also expensive to replace a nurse. Statistics show us that to replace a nurse in the United States costs on average about $25,000. So every time your facility has to go out and recruit, train, and hire a new nurse, it's costing your hospital about $25,000. If you work in a hospital with 1,000 nurses and you have to replace 25% or 250 of them, that's going to cost your hospital $6.25 million. Let me say that again. It's going to cost your hospital $6.25 million in the coming year to replace nurses who leave. And this is money that is not going to be spent on patient safety and quality initiatives. So what can we do about that? Well, here's 4 tips that I can offer you. Tip number 1, make sure your nurses and physicians get really fabulous and effective teamwork and communication training. When I say nurses and physicians, I mean the teamwork and communication training has to be interdisciplinary. They have to train together, either in the classroom or in the simulation lab. It's in training together that the silos and communication barriers are broken down and that collegial atmosphere is created that enhances nurse job satisfaction. Tip number 2, make sure your nurses and your physicians jointly create what we would call hardwired safety tools. Your checklists, your briefing guides, your communication scripting, your standardized way of working together and communicating. It's in jointly creating these tools that you eliminate confusion and conflict and further enhance job satisfaction and employee satisfaction. It will greatly impact your turnover. The third tip I would offer you is to make sure that you have an ironclad and crystal clear chain of command policy. So if one of your nurses encounters another team member who refuses to abide or adhere to standardized way of providing care, they know immediately who they can call, and that whoever it is they call will immediately come to the bedside to support them. So make sure they know who to call, and that if they do call, you'll come and support that stop-the-line behavior that is done in the best interest of patient safety and quality of care. Tip number 4, publicly, loudly, and often reward stop-the-line behavior by your nurses. Every time you see true stop-the-line behavior that preserves patient safety and quality of care, you've got to reward that. Behavior that gets rewarded gets repeated. So write handwritten thank you notes, create case studies, put laudatory written reports in your nurse's personnel file. Make them know that you truly care about their stop-the-line behavior. Now, the question you quite rightly will ask at this point is it really that easy? Can doing these 4 things impact nursing turnover? I say the answer is absolutely yes. I'll give you a couple of examples. In Tennessee, in a very large medical center, These steps and others like them were implemented in surgical services. Nursing turnover was reduced from 14% to 2%. And not only was nursing turnover reduced, when job satisfaction was measured with an employee satisfaction survey, job satisfaction in surgical services was statistically and significantly higher than the other departments in the hospital that hadn't implemented these sorts of tactics and steps. In a smaller hospital in the state of Illinois, in the intensive care unit, nursing turnover was reduced from 19% to just over 4%. And it will come as no surprise to you when the job situation and the turnover situation was stabilized that the quality of care also improved. So the risk-adjusted mortality of the patients in the ICU and their length of stay both decreased once nursing turnover was reduced to about 4%. One last example. In the state of New Mexico, in a hospital that had a unit within the hospital that required 300 full-time nurses. A lot of turnover, a lot of agency and travel nurses. In fact, on a daily basis, of their 300 nurses, they were only able to fill about 240 of those positions permanently, meaning they had to fill 60 positions on a daily basis with travelers and agency nurses. After implementing these 4 steps, that unit was able to fill all 300 positions and totally eliminate the need for agency and travel nurses, and also eliminate the need for mandatory overtime. Again, it will come as no surprise to you that when they stabilize the turnover situation, that patient harming errors and sentinel events were totally eliminated. So the bottom line here is that with a very small investment of time in terms of teamwork training and standardized processes, you can control nursing turnover and dramatically impact patient safety and quality. Thank you.